Hi everyone, Dr. Adrienne with Healthy Living Chiropractic. Hope you guys are all having a fantastic Thursday today. The sun is shining, it is beautiful here in Minnesota, and spring has come, so yay! Today we are talking about newborns and why newborn babies should be checked by a pediatric certified chiropractor. So yesterday I saw 3 pregnant women yesterday in our office, working on them during their pregnancy. Like we discussed last week, we talked about chiropractic and pregnancy, right? So I saw 3 pregnant women yesterday. All 3 should be having their babies within the next week to 3 weeks. So pretty soon we're gonna have a new influx of new babies in our practice. And I'm gonna talk today why it is important to check babies after their birth. So we talked about last week how when the uterus and the pelvis is a little off balance, sometimes that can create an abnormal position for the baby to be in. Think about that baby. If they're in there, and obviously it's a very tight fit in there, if they're breech, meaning their head's up, or if they're in an abnormal position, that's going to put a lot of stress and tension on the baby as well. Sure, it feels uncomfortable for the mom, but the kid could have their head turned, they could have their head tilted. There could be a lot of different things going on with them, creating some unusual tension that's really not supposed to be there when they're in utero. And then you think of the birth process, right? That's a big baby coming out of a tiny small hole. That is not the most comfortable thing in the world, and it can do a lot of it's supposed to do some squeezing, obviously, to push the baby out. But if there is maybe some abnormal movements or abnormal tight spots in the baby, that can accentuate that or kind of create more problems for the baby. So it's really good to get them checked after they're born. All of my patients that are pregnant, we do give a complimentary free baby check for the babies as long as they're 8 weeks of age or younger. So that's kind of part of a benefit to coming to our practice while you're pregnant, is we do a free checkup for the baby because we just feel it's so important to make sure that they're doing well. So people are always asking me, why should a newborn be adjusted? Well, the main reason is we usually okay, sorry, something just happened with my phone. If there's something that they're not sleeping the way that they should, or if they're unusually tense, that is a problem. If a baby is unusually fussy, like I mentioned, if they're not nursing properly, if they're not eating, if there's pain with the mom when they're eating, that's a big red flag as well. Other things that we can see, if they're really gassy, if their belly's really hard, if they're arching their back quite a bit, if they're laying down and their fists are clenched up really, really tight, that's a sign of tightness as well too. If their head is turned to one side or tilted to one side, if they're not turning either way, if they can only feed on one side, that's again an indicator that there's a problem with the baby. Additionally, if there is just overall stiffness, you can tell if a baby is calm and relaxed. Their hands are open, they're sleeping kind of in this type of position. If they're sleeping all tucked in and really, really tense, that's a sign that there's some dural or spinal tension with the baby. A great reason why they should be checked. So what types of things, how do we evaluate a new baby, right? First of all, we use fingertip pressure. So we use the kind of pressure you would use if you've got, like, say, a really super ripe tomato, you don't want to bruise the tomato. It's such gentle pressure. Babies' spinal columns are mostly cartilage, so there's really not a lot of bone adjusting or cracking, and we'll talk about that here in a few minutes. But the first thing I do when a newborn is on my table is I'm looking at how they're spontaneously moving. Are they moving both of their arms? Are they moving both of their legs? Are they really stiff on one side? Are they able to relax their body? Are they super tense? Are they arching, kind of like I mentioned before? Are they turning their head? So there's a lot of visual inspection that I do. We look at range of motion. So I take the baby and kind of fold them in half and just kind of twist them and turn them from side to side. Kind of check their trunk motion. We check their gentle head motion. Babies should be able to look all the way over their shoulder, and if they don't, there's a problem with that motion. We want to make sure that there is not any tongue tie or lip tie. So we go ahead and we evaluate the mouth. We evaluate the tongue. We look at the head and the cranium, make sure that the cranial bones are in good positions and doing well. We also will kind of walk up the spinal column with literally my fingertips, and I just have the baby laying on their back, and I'm just kind of touching. You can tell if there's a spot that's uncomfortable for a baby, they'll cry. And there really shouldn't be. Oftentimes I can hold the baby while doing it, so I can hold the baby in my arm and just kind of gently touch my fingers on their back. It's a great way to evaluate them whilst holding them at the same time. So the evaluation is very easy, comfortable for the most part on the baby. But with adjustments, like I said, people are always like, oh, how do you adjust a baby? Do you do just like me? Do you do the twisting? No, there is no twisting of babies' necks. I don't do any twisting of kids' necks until they're at least 7 or 8 years old. So there isn't any of that in our practice. Literally, like I mentioned before, it's fingertip pressure. We use just really, really gentle pressure on the baby. The big thing is helping those joints to move properly. If the joints are really tight, if the dura, which is the covering of kind of the brain and the spinal cord, if that's really tight and tense, we can do some gentle stretches. If you guys follow me on Facebook or Instagram and you guys see other videos that I do, I've got a lot of videos of adjusting infants and babies. Oftentimes they're smiling. If they're not loving what we're doing, oftentimes we'll have them feed, either nurse or take a bottle that helps to kind of calm them a little bit, because just like you, if you've got a tight spot that's being worked on, it's not the most comfortable thing in the world, but we are as gentle as we can be, and the babies are for the most part extremely comfortable when we're adjusting them. So just kind of in summary, some of the things that we do see after babies get adjusted: they're sleeping better, they're a lot more calm, they're not as fussy, they're not as gassy, they're eating better, they're pooping better. One thing that pediatricians oftentimes will tell kids that, oh, it's normal for a breastfed baby to not go poop for 3 or 4 days. It's not normal. Babies need to poop daily, multiple times a day. Humans need to poop multiple times a day. That's not okay for all that stuff to sit inside your gut, and that's a whole nother conversation, but you need to be pooping often. So if a baby is a little constipated and they're not going every day, you need to get them checked. But they poop better, they're more comfortable, they lie with their hands open versus all balled up in little fists. They're more content overall. So really our main focus here is just helping moms and babies to be comfortable. We want these babies to grow up and thrive and be the healthiest things that they can be. The kids that I work on from birth to whatever age are honestly the healthiest babies that I've ever seen and the healthiest kids. So if you are curious about chiropractic for kids, I would love to have a conversation with you to learn, to see what your concerns are or questions. If you know someone who's pregnant, I would love for you to share this video with them and share with them why it is important for their kid to get checked after they're born. And if you know someone who's got a baby that maybe is a little fussier than you would think or than they should be, would love to be able to talk with them. Share this video with them, if anything, and if they've got questions, we'd love to help. So I hope you guys all have a really good day today. Happy Thursday, happy spring, and let me know if I can help with anything. Bye.